then I'll be able to get to some of those questions I saw pop up in the chat. But thank you to everyone at the coffee shop for inviting me here. And I look forward to the rest of tonight's program.
Thank you, David. That was some great information. We really appreciate that. There was a lot of chatter in the chat box, so we will definitely be coming back to quite a few questions. While we're doing our next presentation, you might be able to answer some of those questions quickly, but I would like to go ahead and introduce our next presenter. Professor Gail Williams has been a faculty member with Miami-Dade College, Benjamin Leon School of Nursing since 2010. Prior to joining Miami-Dade College, she taught in various nursing programs, bringing with her wide-ranging experience with her. She earned her master's degree in nursing from the University of Phoenix online program in 2007. And Professor Williams is an AQ credential and certified online educator and she is also Quality Matters. So Professor Williams, please go ahead and share.
Good evening. Thank you very much for that nice introduction. I have a different group of students. We have a very prescribed course of study because we are a nursing program. I chose to reinvent my test item writing assignment. I did it because I want these students to see the importance of the course. They think that test items are easy to write. You can do a test in a very short order. I find that by addressing the course to their professional behaviors, they buy in a little better. It also, when they write questions, I have them give me rationales for the right and the wrong answers, and it helps them to uncover areas if there's someplace they're not sure about. Sometimes the students are not as eager to answer questions. They see professors that are teaching nursing have been nurses forever, so it seems, and they're kind of embarrassed to let us know that they might have something they need to work on. So when I did face-to-face, they would follow me to my office. Now it's more difficult to do that with this blended. We are officially blended, but we're mostly remote. Let's see, I have synchronous and I have blended. Our synchronous learning, we are all online. Miami-Dade has the opportunity to have some of the faculty remain online and off campus. Nursing is pretty much that way. The only thing nursing goes on campus for is to practice their nursing skills once they learn them. So when it's face-to-face, you have a lot more interaction. When it's online, it can be extremely challenging. I have found in this past 10, 11 months that my students will come to class, but they'll also be working. So, I have to find a way to make them feel that the course is not a second rate. It's an important course to have. My learners are in the nursing program at Miami-Dade College. They've done all their prereqs. Some of those courses that Dr. Peridian mentioned, they take chemistry and micro and things like that. Then they come to us. My learners are primarily adult learners. I don't have too many people that are directly out of high school because they need to get their prereqs done before they are admitted to nursing. And that usually takes, a year, 3 to 4 semesters to do. I have more and more males in the nursing class. So I have a combination of anybody, variety of ages and life experiences. I teach in a part of the nursing that is our transitional program. That means that people that have licenses in the medical field, we give them credit kind of for the beginning. So we go ahead and teach them the registered nurse part. They may be LPNs, they might be paramedics, respiratory therapists. So we acknowledge that knowledge base and we don't spend that whole time re-teaching them. I find very honestly that not too many people are interested in obstetrics. The guys just kind of go, that's a woman's thing. And the girls go, I don't want to work there. They all want to be someplace more exciting, an ICU or an ER. I've had a couple students tell me they want to do flight nursing and they doubted they'd ever need obstetrics for that. Some of them, if they are being honest when I ask them, they are just doing this course because they need it to graduate. And I've had many a student tell me, how do I pass your class? What are you testing on? What's the content? That's all I want to do is pass. So it's kind of an interesting group. I did this originally about a year ago, and I had very poor return. Nobody was doing it. The important thing with that is we have a set prescribed curriculum. We have a set amount of testing. And we don't have extra ability to give extra points for something. And the other thing I should mention also is this course is only 5 weeks long. In the summer, we're 4 weeks long. So we're taking a lot of information and trying to put it in. The students didn't see the need to finish the work. After taking some of the online AQ courses this past fall, I decided to redo this assignment and modify it a little bit. And I find it works a lot better on take 2. I talk with them at the very first class. I mention the assignment. I go over the assignment, how they can be successful in this assignment. I also provide them a PowerPoint with different types of questions. We are geared for them to pass their licensing exam, their NCLEX exam. And so I kind of recommend that they look at question types that are used in the NCLEX. Multiple choice, select all that apply, fill in the blank. We don't do too much true and false. But I find a lot of students don't know how to take a true and false test. So I give them the examples. I give them the right answers and the wrong answers. And then I require they give me rationales. Why was this answer wrong and why is this answer correct? So I put that in my classroom. I post it in Blackboard for them, and they're able to go back to that, and they're able to see how it is, what I expect, I guess. I didn't do that before. And when you're face to face, it's a whole lot easier to visit with your professor and find out exactly what they want than if you are remote or blended, especially if you're working. I remind them every class when the due date is, what we need to do, how we need to do it. I ask if there's any questions, let me know, come up privately, say you want to meet with me. I also have found great success by relating this assignment to professional behaviors. Okay, nursing has professional behaviors. We have to have them. Everybody does, and everybody's professional behaviors are different. So I discuss professional behaviors with my students, and it is doing an assignment is a professional behavior. Like I tell them, you get a patient assignment when you go to work. You don't have the option of saying, hey, I'm not going to do that today. You need to do what chores or tasks or patients you've been given. I find that by merging the assignment with their professions, I get better buy-in. I have also gone to students and said, how would you, as a respiratory therapist, what would you do if you didn't do the assignment? What kind of issues are the consequences? And I find that when they know that it's important, how it will affect them in the future, even if they don't want to be an OB nurse, I have a much better turnout. Since I've revised this assignment, I have not had anybody that did not do it. Whereas before I revised it, I had very few people that actually did it. I've learned that learners don't always need points or grades. It's nice, but again, in nursing, we don't have that opportunity. We do no extra credit. We're dealing with a topic and a content that doesn't lend itself to extra credit. We don't get extra time, and if we make a goof, we don't get to go back and fix it. We need to be right from the very beginning. I find that my students will complete this assignment when the directions are very clear and when they have examples. Relating it to the knowledge of their profession, either the profession they have now or the profession they're going to be as a registered nurse. We have a lot of LPNs, and they understand that, hey, wait a minute, these behaviors have to be done. We also, I have it in my syllabus, we have it in our nursing clinical syllabi, that professional behaviors, if you don't abide by them and demonstrate them, you have a chance of not being successful in that clinical setting. The students will, if they understand the importance of the assignment and they have examples, they are much more willing to do the work, and they do it fairly easily. And there are questions that they're harder on themselves than I am. Some of the questions they write are very detailed. I also have taken some of their questions with their permission, changed it a little bit, and I use it on subsequent tests. That's kind of like an extra credit for some of the students. They get really excited because I felt they wrote a good enough question that I wanted to use it. So that isn't as much of a push, but it is a little perk. My final takeaway from doing this experiment, or now doing this assignment, is that they will complete tasks in the classroom when there's a clear understanding of how the work will assist them in their chosen profession. They are adult learners. They learn by needing to know why they need to know it. I mean, all of us, I'm sure we didn't get our higher education degrees when we were very young. And as we did things in those classes, it was nice to know why this is an important thing for me to do in this class. And the students have that. They are more than willing to attach and attempt. They're more than willing to rewrite the assignment if they think that, maybe it's not the best for them. And I've had good luck with them now completing it. I find, especially with the remote learning, the online learning, the students are a little bit more connected. They feel like they actually have a piece of the class. Some of them will want to know, show my questions to the group and see what they think. So they're beginning to buy in many ways. These students start the nursing program and they stay with the same cohort of students through the entire 4-semester program. So they're not new to each other, but the faculty is the new person. So, it's an interesting reverse of a lot of times you stay in the same room, teach the same content, or you're in your office. Whereas these students are all together and we move in with them and find, I have to get to know them. Some of the things I used to ask them, they're like, we already know that about each other. I'm like, yeah, but I don't. So this is an assignment that they get to show some of their knowledge, and they understand the importance of this in their